Dr. Kanchan RATHORE. So she'll be speaking on needle in a haystack or bullseye treatment, decoding PST injections.
Good morning, everybody. I'm Dr. Kanchan RATHORE. I'm Associate Professor in Symbiosis Medical College, Pune. So I will be presenting on topic needle in a haystack or bullseye treatment, decoding posterior subrenal injections. Now, posterior subrenal injections is not a new concept we have been giving from ages. So, though this practice we are following, but I want to present what is my observation in uveitis cases. So, just giving a small introduction about the definitions. Vitreoretinitis is a condition characterized by inflammation affecting both the vitreous humor and the retina, often leading to a significant visual impairment if left untreated. In cases where the inflammation persists and does not resolve on its own, corticosteroids are considered the primary and the most effective treatment options. Now, steroids can be administered into eye through several routes depending on the severity and location of the inflammation. So, among this, posterior subrenal injection of triamcinolone acetonide has proven to be a particularly effective approach. Now, this is because of the targeted approach to the posterior segment. Now, when a case of uveitis comes, when we give the treatment, the subjective, from the patient point of view, the vision is always decreased because of the vitreous haze. So, if there's a decrease in the vitreous haze, the patient is satisfied with the treatment because they don't understand the actual treatment we give according to etiology. So, here I am presenting on the cases according to the vision, not going into the causes of the uveitis. So, the main objective was to evaluate the efficacy of posterior subrenal injection of triamcinolone in cases of intermediate uveitis and vitreoretinitis not responsive to oral corticosteroids. So, we analyzed the medical records of 27 consecutive patients, 34 eyes that is, who underwent posterior subrenal injections of triamcinolone for the management of intermediate uveitis and posterior uveitis. So, data on visual outcome and potential side effects were gathered for evaluations. So, absence of clinical response to adequate dose of systemic steroid for a period of 2 weeks were included in the study. After PST injections, patients were followed up for the second week, 1 month, 3rd month, and 6th month post-injection. During each follow-up visit, we took visual acuity, dilated fundus examination, and IOP measurement. And data was analyzed using descriptive statistic. So, on the presentation, visual acuity at the baseline, all patients had best corrected visual acuity was than 6/60. 25% presented with retinitis alone, 41% had retinitis accompanied by macular edema, 34% had retinitis and macular edema along with the additional findings such as vasculitis or disc edema, and 15% had vitritis alone. So, outcome after 6 months, in the improvement in visual acuity, 75% achieved a visual acuity better than 6/12, 3 patients improved to 6/18, and 7 improved to 6/24. So, mean logMAR visual acuity before PST was 1.3 and after PST 0.2. So, it was statistically significant. 50% showed complete resolution, 34% had complete resolution but atrophic scarring, and 16% experienced incomplete resolution. So, median follow-up months of my patients were 26.5. Snellen visual acuity improved by at least 2 lines in 23 of 32 eyes of patients which were examined after initial injection. Median time to improvement was 3 weeks. Patients with visual improvement had a median age of 27 years compared with 47.5 years for the non-responders. Increase of intraocular pressure, that is more than 21, occurred in 8 patients with onset at the median of 3 weeks after initial injection. The median interval to peak increase from 25 to 44 was 16 weeks after the injection. So, discussion. Now, majority of steroids utilized in ophthalmology are glucocorticoids known for their anti-inflammatory and immunosuppressive properties. Now, triamcinolone acetonide is a suspension with low water solubility and its crystals gradually dissolve into vitreous. Now, this process establishes a diffusional gradient from vitreous to macula, ensuring minimal systemic absorption. So, in our study, a single posterior subtendral injection of triamcinolone acetonide demonstrated significant improvement in visual acuity and a marked reduction in macular edema. So, from the conclusion of my study, subtendral injection of triamcinolone had affected the patient of uveitis and had given a better outcome. Thank you.
So PST actually, I am not a very firm believer of.
Yeah.
And what was the criteria for resolution? You said 50% resolution was, 50% patients had complete resolution. So how do you define resolution?
So basically on the visual acuity. Visual
I'm
acuity
sorry,
and
but
clinical
visual
picture.
acuity is not a
So you must be
indicator
looking
for
at
resolution.
macular edema, maybe vitritis.
The macular edema resolved on OCT. The retinitis, maybe you can do an angiography and take a call, or an autofluorescence. So I wanted to understand, how do you say that 50% had complete resolution?
So complete resolution at the like patient visual acuity was improved, the clinical picture was improved. On the basis of that, resolution was.
No. What I'm trying to say is visual acuity is not the only criteria for resolution, right?
Huh. The lesions basically, the lesions.
How? That is what I'm asking. You just clinically you defined it as it has resolved or not?
So
You
clinic.
didn't do any investigation.
No,
for
no,
that.
sir. For specific patient did angiography also, specific patient did OCT also. But the final criteria that patient, because it was subjective whether patient was happy or not. So that was the visual acuity.
So like 50% of the patients got 6/6 vision. That is what
Yeah,
you're trying to say.
around, yeah.
But then that cannot be how we define resolution in the case of retinitis,
Yeah.
because that is bound to
Resolution
be
is not because on the basis of vision. That is my take.
so
You may have an intermediate uveitis patient with a 6/6 vision. So that does not mean that the patient has resolved. Also, in my personal experience, vitritis or intermediate uveitis, yes, they might at times respond to PST, but surely retinitis per se does not respond.
So initially I have never given in this, when the infective part was there. Only when they had a
How do you
recurrent.
decide that it is infective or not?
So on the basis of investigation, here I have not gone into that etiology part because this was only for the
that's okay.
subtenons only.
Another question I have is, you said that there was a significant age gap in the patients who responded versus who were
Yeah,
non-responders.
yeah,
So
yeah.
how do you explain that?
So basically, it is immunosuppressive.
So
So those patients, I don't have a clear explanation, but that is just an observation that patients who were a bit older, they had a little less recovery as compared to the younger patients.
I mean, again, probably because you are defining recovery on basis of visual acuity, that is why older patients have much more morbidity and are being classified as non-responders. Because otherwise, I do not see any.
So it's
way
like
to-
confounding.
I'll say, see, for your resolution, either you make it macular edema on OCT, and that 34% complete resolution with atrophic scarring also sort of takes care of that, because you probably saw some scarring in the macula. So visual acuity cannot be your criteria for resolution in
Okay.
uveitis, retinitis. It's very, very confounding. Yeah, thank you.
Okay, thank you.